Sounds familiar? Well, a little too familiar, I would say, with itchy throats and hoarse voices all around.
I keep reading about the scary stories of Delhi's polluted air. I was horrified to recently see that even Mumbai's pollution levels are also touching new highs.
I had no history of respiratory illness, but now I think because of this construction, I have developed some respiratory congestion.
My child, who's 5-year-old, has had a cough for the last several months. Our doctor also told us recently that wheezing is becoming more and more common even among kids of Bombay.
I recently came out of a very bad viral, which also aggravated my tonsillitis.
The most traumatic bit is that the impact it has on our children.
My breathing is unstable and pollution is playing a huge part in it.
Really, it's really getting worse.
As I look out of my window, the grey Gurgaon skyline is something we've all become used to come Diwali. But it refuses to clear out. My producer Vinay, who you just heard by the way, has been down with a bad case of tonsillitis, he informs me in almost a consoling manner. He says Mumbai is mirroring Gotham City with the dust in the air, refusing to settle down. This, in fact, has forced families to take some harsh decisions.
My name is Shrikant Khandekar, and I am the co-founder and CEO of AFAX. Our 9-year-old son Jay developed a persistent cough. The doctor shrugged and said many children had this problem. We happened to visit Coorg for a holiday, and magically, in just a couple of days, Jay's cough disappeared. The problem was pollution.
From Delhi NCR to Mumbai to Bangalore, all the way to flood-hit Chennai, worsening air and choking lungs is making cough syrup the drink of choice this season. Banning old vehicles or random curbs on construction, nothing seems to be working. How long can we afford to keep shutting schools and offices? Is grey, gloomy and suffocating the new normal? What can you do to breathe a little better? These are the questions we try and get answers to from an eclectic set of guests that give us some shocking realities.
My waiting room is full of the same noise that is cough. Air pollution is a community problem. We know 14 out of the 20 most polluted cities in the world are in India.
It is a problem that has grown in other parts of India as well.
It means that in the next 20 years, we will have an epidemic of lung cancer cases in our country. Solutions are there. Solutions are not a rocket science. It's not something which is waiting to be discovered.
I'm your host Ratna Bhushan from the Economic Times. It's Thursday, December 15th, and you're listening to a Breathless Bharat on the Morning Brief. Joining me today, renowned expert Dr Arvind Kumar, Chairman Institute of Chest Surgery at Medanta Hospital, specialist in treating chest and lung-related surgeries. Dr. Kumar also works closely on how to combat issues caused by air pollution and climate change and has set up a social impact trust called the Lung Care Foundation. Also joining in the conversation is a champion campaigner for clean air and public health, Anumita Roychowdhury from the Center for Science and Environment. And giving us company is also someone who's helping us deal with all the dust. Bharadwaj, or Bharat as he's popularly known, Managing Director at Aura Air, which has just tied up with Wipro. Thank you very much everyone for joining us. Dr. Kumar, let me start with you. How busy is your waiting room?
My waiting room is full of the same noise which you wanted to be excused of, that is cough. So if you sit in my outdoor clinic, you will have a variety of coughs from a very mild one to very severe one, and from one variety to the other. Not only that, wherever I'm going these days, any house, any social meeting, the moment they come to know that I'm a chest doctor, the next question is, oh, doctor, I have a bad cough. Can you tell me some remedy? So cough is now a national problem, and the cause is, which you have already stated, the nationally present pollution.
Okay, I am going to ask you about my cough remedy too after this podcast. Doctor, important point raised by you. It's a national phenomena. Now, Medanta Hospital has released a report of over 300 lung cancer patients treated by you and your team. I was reading that what's alarming is that an increasing number of those patients are non-smokers and younger. This is almost like a pandemic which is happening annually. How worrying is this?
So, Ratna, I'm a chest surgeon and I have been operating on chest for over 30 years now. And so, late 80s, when I started operating, I used to see mostly pink lungs, except when heavy smokers were there who used to have black deposits on their lung. And let me tell you, for the last 10 years, have not seen a single person, be it from any part of the country, with nice pink lungs. Smokers or non-smokers, everyone has deposits. I even see deposits on the lungs of teenagers now, which is so worrisome. That is what prompted me 7 years back to start Lung Care Foundation to share these information with public. Now, on the basis of this, we thought, let's look at our lung cancer cases, what's happening to them. And we compared our 1988 case profile of lung cancer to recent. And we were astonished to find 7 very, very disturbing findings. Number one, there is more and more of lung cancer occurring today, both in men and women, absolute numbers, than 30 years back. Number two, there is lung cancer occurring at younger and younger age, with 20% of the patients below 50, 10% below 40, and 3% even below 30 years of age. Yani, number three, 40% of the patients today are women, which was a very small number at that time. And number four, most worrisome, 50% of my patients today are non-smokers, or if I may use the word so-called non-smokers, who have never smoked, but I call them so-called non-smokers because I say that there is no true non-smoker in India. Everybody in India is a smoker because of the polluted air they breathe. Next, we found 30% of these patients had been misdiagnosed initially as tuberculosis, and they had received anti-tubercular treatment, wasting precious time in diagnosis. We also found that 80% of the patients were being diagnosed in late stage, and we also found that there was a worse variety of lung cancer, which was tending to increase in numbers compared to 30 years back. So overall, it means that in the next 20 years, we will have an epidemic of lung cancer cases in our country. And I'm sorry to state that the medical infrastructure which exists today in the country is just not prepared to be able to cope with that kind of an onslaught which will occur. So overall, a very bleak and a very grim scenario for the coming 2 decades as far as lung cancer scene is concerned.
Anumita, I'd like to bring you in here. What used to be an annual Delhi problem is now spilled over to Mumbai, Bangalore, Chennai, everywhere. So what can we do to prevent pollution? I mean, how long can we just shut down schools, sand vehicles, sand offices, from December, January, February?
You're absolutely right, Ratna, that today air pollution has grown to be a national health crisis. But what is very important for us to understand is that air pollution is not only a Delhi problem, it is also not only an Indo-Gangetic problem, but it is a problem that has grown in other parts of India as well. But the irony is that a lot of people think as if that there are safer places in Eastern India, in Western India, in Southern India, far away from Indo-Gangetic plain, where they can actually escape the problem. But that's really not true. Because even if, when you look at it from the health risk perspective, then that risk is pretty uniformly spread across the country. And the reason I'm saying this is the evidence to show that most of the deaths and illness occur at a level of pollution that is much lower than what you see in the Indo-Gangetic plain. So you really don't need to be in Delhi to fall ill and die. You are equally at risk in other parts of India, and especially if you look at the number of deaths per 100,000 people, then it is quite uniformly distributed. Now, having said that, It is important, therefore, to underscore the reason why this kind of health crisis and health emergency has taken shape is simply because that even though we have national ambient air quality standard to define the clean air benchmark, but we do not have a template or a framework in place as of now that can help to meet the clean air target in each and every region. We have national clean air program, but that is confined only to some cities, about 132 cities. But understand it requires to be a multi-sector action so that we are able to reduce pollution from each and every source, from vehicles, industry, power plant, construction, waste burning, what you may call it. And each of these will have to be done in all the geographies. And pollution doesn't follow administrative boundaries, blowing between boundaries. So you cannot have small, tiny hamlets or municipalities or a town being cleaned up if the rest of the region is dirty. That means that we still haven't been able to build a system and a framework where we will be able to roll out solutions at a scale and with speed and urgency so that we can meet the clean air benchmark. And the fact that you're asking that what is it that we need to do? We need to see massive transition, which one is the clean fuel transition and clean technology transition in all sectors of pollution, vehicles and industry and power plant. We need to scale up our ability to do proper waste management, segregation, recycling, reuse, and also dealing with legacy waste in our dump site so that the waste does not accumulate in the open for people to burn. Now, these solutions are not rocket science, but institutional capability, regulatory action, enforcement strategy, detailing out the implementation, organizing funding, and making it a mandate at the lowest level of administration, at the level of municipalities, at the level of wherever the action has to be. That part will have to be strengthened with accountability and a very stringent compliance strategy.
Dr. Kumar, so the buck stops at the policymakers, local authorities, and the state governments?
So, Ratna, two things. First of all, I would like to re echo the statement she made that solutions are there. Solutions are not a rocket science. It's not something which is waiting to be discovered. It's there. What is lacking is a political and administrative and people's will to implement it on a scale and on an urgency with which it needs to be implemented. When COVID came and started killing, we took historic decisions never before taken in the history of mankind because we thought it was needed. Unfortunately, air pollution is killing more people than COVID did, but we are not responding with the same alarm status that we did to COVID. And that is the sad part because people are not yet understanding the gravity to which it is hitting and hurting the present generation. And Ratna, let me tell that more than the present generation, it is hurting the next generation. There is evidence to suggest that the effects of air pollution are starting on the child in the uterus of a pregnant mother. There are congenital defects happening. Children are losing their IQ, they are losing their lung development, they are losing their height development. If I may say, the next generation is getting diseased and maimed because of the ill affection. It's a huge national medical emergency, the gravity of which has not yet dawned on people. And therefore, we think of cosmetic solutions rather than real-time solutions.
Till big policy changes are made, those choking are taking things in their own hands. Let me introduce Bharat from Aura Air. Bharat, you've been in India for over a year now. Has the demand been unreal as the air quality gets worse?
Thank you for having me. So Aura Air is a product of Israel. We've come into India about a year and a half back, as you said, and we've had some excellent traction. We've sold it to a lot of government agencies, including nuclear power plants, the space research centers. We've also sold it to the hospitality industry, including 5-star and 7-star hotels located across India. We've sold it to the healthcare sector, hospitals, IVF clinics, ICUs. So, we had some great traction, private sector companies, IT and ES space. And we're growing by the day.
And what about households?
Our main focus is to work with enterprises to start with. We're not a very consumer-oriented brand yet. So this is why we're not selling a lot to the household sector.
Okay, let me bring you in here, Dr. Kumar. Are air purifiers within closed doors healthy? Because there are multiple studies which have a contradictory point of view. I'd like you to address this.
So, Ratna, air pollution is a community problem. Air purifier is a personal solution which will only work on the people who are in that vicinity for as long as they are in the vicinity. Now, this mistake we did for our water crisis and electricity crisis, that instead of fixing the problem, we went for personal solutions to the community problem. And I'm sorry to say that country seems to be repeating the same mistake with the air, not realizing that air pollution is very different from water pollution and electricity crisis. Can you carry your air with you? So while congratulating Bharat for bringing this revolutionary technology, which can only help few people for few hours, to some extent, the solution lies, as Anumita said, in finding the sources, which is the use of fossil fuels and dust, and addressing them at source, which is the only way to address this problem. If we go the wrong way, I'm sorry to say, the country and the future generation, our children, will have to pay a very heavy price of the mistake of the present generation.
Bharat, what are your views on this?
I completely echo with the statement that Dr. Kumar has said, right? This is a personal solution. Let me just share a few facts. Like, we know 14 out of the 20 most polluted cities in the world are in India. And having poor outdoor air quality predominantly due to man-made reasons. In the meantime, we cannot expect people to suffer, right? And this is where we think we have some value to offer. We want to help people live healthier lives because we spend more than 80 to 90% of our time indoors. And when we are indoors, it is not just the air quality, but also the amount of chemicals. Like in the 1950s, we barely had a few thousand chemicals. But if you take 2000, there are over 3 million registered chemicals in the world. And where do most of these chemicals end up? They end up inside our indoor spaces as products. Your tables, chairs, everything have chemicals in them. And these chemicals emit a lot of small gases, as Dr. Kumar was saying earlier, VOCs. It's not just the outdoor air quality, but indoor air quality and indoor pollution comes from many other things. And these things have shown a lot more correlation with incidence of diseases like cancer, like in the long run exposure to these things. So that is where we think that, we have value to add in terms of helping people breathe cleaner air where they spend most of the times indoors.
Absolutely, Bharat. Anumita, I would like to bring you here again. Let me refer to CSC's latest study. It says that in October-November, Delhi saw the least amount of pollution in 8 years. So on a positive note, is that to do with warmer weather, lesser amount of crop burning, or preemptive action by the municipalities and district authorities?
It's a combination of factors. One, that Diwali happened early during October. NASA numbers and also what ISRO has reported that the crop burning reduced this year. And one new thing that happened this year is the fact that Delhi and NCR could take preemptive action based on the forecasting facility that is now available in this city. But now the rest of the winter, we still have to wait and see what's going to happen. Keeping in mind that the first half of winter is more about the farm fires, pollution coming from outside. But now we are in a situation where a lot of local pollution impacts are going to be seen. And what we are beginning to see over a period of time, that on an annual basis, the annual average levels of pollution are not going up steadily. There is a stabilization. But the challenge is that even after that stabilization, Delhi requires another 60% reduction in its annual average of PM 2.5 to be able to meet the clean air standard. Now, this is something that we all need to understand, that what it takes to control and reduce pollution. In fact, the good air quality definition in India is when you meet a level that is 50% below the standard. That's when you begin to protect public health, not above that. But how will you achieve that? And that's something people will really have to understand. But it is not easy to clean up the air. If you look at Delhi, in fact, Delhi has done a lot more than what other cities have done. Delhi is today showing that even after doing all of these things, vehicles are contributing about 50% of its local pollution. We have started to reduce and bend the pollution curve, but we also have to keep in mind that what the Western world took about 50 to 60 years to clean up the air. So imagine therefore the scale of investment, scale of infrastructure to be developed, scale of systems to be reformed, and the policy push that we require to be able to make the change happen.
So, for now, the doctor's prescription is the only immediate remedy. Dr. Kumar, cough syrups and nebulizers are no longer just seasonal visitors on your prescription pad anymore, are they?
A very important statement you made, Ratna, that come Diwali and what I call now annual pollution festival, if I may use that word. Whereas if you look at data, air pollution is a perennial problem. It is only that during these months, the visible air quality becomes so bad that it becomes an optically visible phenomenon, whereas the rest of the time it is not that bad. Regarding nebulizers, cough syrups, their sale is directly related to the amount of symptoms patients have. I was speaking to a pediatrician yesterday who has a very busy practice, and she told me, Dr. Kumar, it's so shocking that today 90% of the patients are only having one problem, and that is cough. When I examine, I find bronchospasm, which is, tightening of the airways. And all I need to give them is nebulizer, nebulizer, nebulizer. Every household which has children these days is buying and having a nebulizer at home.
Anumita, I was reading one of your interviews recently where you called out the pollution hotspots as the smaller cities also. For some reason, the spotlight is only on the metros because I guess we are all here and, it gets highlighted and intensified on social media, etc. But what can we do to drive change in these smaller markets? I mean, what should the critical points of intervention be?
I mean, we now really have to work at different scale. So unless we address the problem at a regional scale, at a state scale, then we will not be able to address the large proliferation of pollution hotspots that is happening and dotting the landscape across the country. We also have to understand that a lot of pollution sources are hugely dispersed. They are not concentrated only inside cities. So you have large number of small scale units, but more important in this distributed pollution, that one very important pollution and social crisis that we still have in India are the large number of chulhas burning in villages, exposing children and women to very high toxic exposure inside their homes. But now the estimates are available to show that how that chulha pollution is also contributing up to 30% of the outdoor air pollution. So in fact, in other countries, when a city is preparing its own clean air action plan, they are also responsible for controlling pollution that is going to be impacted from their city to the cities or other regions downwind. So they establish the responsibility of upwind polluter for the downwind air quality. They in fact call it a good neighbor policy, so that one city or one state does not pollute another state. That is the kind of accountability, the Council of States that we need to create at the top level, and then bring down that whole vertical accountability down to the municipality level, down to the village level. That is the comprehensive approach that we require, and that's what we have seen works in other parts of the world, where they have focused both on hyper-local pollution as well as the transboundary movement of pollution.
Closing remarks from you, Dr. Kumar. How much medication is too much? Like if I have a cough, Do I take cough syrup for 3 months? What is the impact that it's having on me and children, for example?
Ratna, every medicine is a chemical and every chemical is a potential poison. So I would not recommend any medication to be taken endlessly or without a proper medical prescription. All cough syrups have lot of medicines which can do harmful effects. All nebulizers can have serious side effects also. So please don't do self medication in these things. Go to the doctor if need be. Take only the doses that are required for as long as it is required. More than that, please join in the form of a national movement to immediately control this problem, is what I would like to appeal through your popular program from all the people of my country.
The situation is scary and suffocating. No longer can we just sit back and hope for the fog to clear. And it's no longer as simple as Vicks ki goli lo, khich khich dur karo. Vicks ki goli lo, khich khich dur karo. Amid passing the buck and political bickering, India, not just Delhi, is choking. Let's not be fooled that if we are seeing a bluer sky today, the problem is over. This, as our conversation highlighted, is a national health crisis with lungs losing color and a younger generation at the brink of losing hope for a breath of fresh air. As a nation that overcame the massive COVID crisis, here's hoping the same policy resolve will lead to a resolution that will make India breathe easy once again. I'm your host Ratna Bhushan, and you were listening to a Breathless Bharat on the Morning Brief. We're signing off and hope you enjoyed listening to this episode. This episode was produced by Vinay Joshi. Sound design, Indranil Bhattacharjee. Executive producers, Anupriya Bahadur, Anirban Chaudhary, and Arijit Barman. Do share this episode if you liked it. Listen to new episodes of The Morning Brief every Tuesday, Thursday, and Friday on all your favorite listening platforms: Amazon Music, Gaana.com, Spotify, Apple, and Google Podcasts, the Economic Times website, and of course, our very own audio platform, ET Play. Also, tune in to the latest podcast from ET, Business of Sports, where we decode all about sports as a business. Tune in every Wednesday for fresh episodes. All clips used in this episode are mentioned in the description. Thank you for listening and have a nice day ahead.